Next this evening, more than 4,000 people in the East Midlands have lost their lives as a result of the first wave of the pandemic. Official data shows that while national attention's been on Leicester, the virus has been less deadly there than in Derby and several rural districts. Well, our social affairs correspondent has been analysing those figures. Just what do they show?
Well, they're a stark reminder, really, Sarah, of why there are such tough choices between protecting livelihoods and protecting lives. We know, of course, that most people survive coronavirus, but there are still thousands of families across the wider East Midlands who haven't been so fortunate. And here you can see the impact since early March. More than 4,200 so-called excess deaths. Most of those in red here had COVID on the death certificate. The others in blue here could include COVID cases that weren't diagnosed, as well as people with other conditions who avoided going to hospital. I think that downward trend does look encouraging. It stayed low for 3 weeks after the lockdown started to ease, and the focus now on stopping those numbers rising again.
Yeah, and of course a lot of the focus has been on Leicester. What impact has it had there?
Well, Leicester is now starting to record more COVID deaths than other places in this region. Numbers, though, still very small, just 6 in the last week. And during the course of the whole pandemic, Leicester's fared better, really. The city's seen 87 COVID deaths for every 100,000 residents. Now, that compares with over 100 in places like Derby, Ashfield, Oadby and Wigston and Gedling. Leicester, one of several areas where the COVID death rate is just above the regional average. Now, elsewhere, including Nottingham, even fewer lives have been lost. But you can see those hotspots cover areas ranging from a former mining area to a city to leafy suburbs. And Professor Keith Neal is an expert in infectious diseases.
We know this disease affects older people, and many of the rural areas and the areas outside the cities will also have a higher proportion of older people. And if you don't leave the house, somebody you live with may bring it into the house, and household transmission is clearly the most recognised risk factor.
And there's been worrying news about care homes today as well. We know they've been hit really hard during this pandemic.
Yeah, there's been a freedom of information request to Derby and Burton hospitals. Now, that found almost 400 patients were discharged to care homes without being tested for COVID-19. Now, the Hospital Trust says it was following national guidance because that happened right at the start of the pandemic. Another development tonight in Melton after a spike in infection rates there. Really important to stress we're talking very small numbers because there's a very small population in the Melton district. But the local council worried enough about that to set up a temporary testing centre.
OK, so putting that in perspective then. Jeremy, thank you very much.